Cervical cancer starts in the cervix, which is the lower part of the uterus that opens into the vagina. It can grow and spread to nearby areas, causing various signs and symptoms. This type of cancer is mainly caused by the human papillomavirus, or HPV, with certain types of HPV increasing the risk. Cervical cancer is common, especially in developing countries, but regular screening through pap smears has reduced its occurrence. Cervical cancer often doesn't show symptoms in its early stages. When symptoms do appear, the most common sign is unusual vaginal bleeding. This might happen after sex, between periods, or after menopause. As the disease progresses, the bleeding can become more frequent and heavier. Other early signs include vaginal discharge, which may start as watery and later turn brownish or have a bad smell. This happens due to inflammation in the cervix caused by the growing cancer. As the cancer spreads, it can cause discomfort or pain during sex, pelvic pain, and unexplained back pain. Some patients may also experience burning during urination or difficulty urinating due to the cancer pressing on the bladder or urethra. In advanced stages, the cancer may cause serious issues like swelling in the legs due to fluid buildup, severe back pain, or kidney problems caused by urine backing up in the kidneys. These are signs that the cancer has spread to other parts of the pelvis. Visible changes in the cervix, such as redness, ulcers, or an easily bleeding surface, can be seen during a medical exam. However, in early cases, the cervix might look normal, and the cancer might only be detected through a pap smear. If cervical cancer is caught early through regular screenings like pap smears, treatment is usually more successful, and the chances of curing the cancer are higher. However, as the disease progresses without detection, it becomes more challenging to treat, and the symptoms can become more severe. In later stages of cervical cancer, other complications can arise as the cancer spreads to different parts of the body. For example, the cancer can block the flow of urine, leading to a condition called hydronephrosis, where the kidneys swell due to the backup of urine. This can cause kidney damage if not treated. Additionally, as the cancer grows and spreads, it can press on the nerves and tissues in the pelvis, leading to constant pain or discomfort in the lower back and pelvic area. Another possible complication is leg edema, where the legs swell due to fluid buildup. This happens because the cancer blocks the lymphatic system, which is responsible for draining excess fluid from the tissues. When the lymphatic system is blocked, fluid accumulates in the legs, causing them to swell. In some cases, the cancer may spread beyond the cervix and pelvis, affecting other organs like the lungs, liver, or bones. When this happens, symptoms can vary widely depending on which organs are affected. For example, if the cancer spreads to the lungs, it may cause a persistent cough or difficulty breathing. If it spreads to the liver, it may cause jaundice, which is yellowing of the skin and eyes, or abdominal pain. The importance of regular screening cannot be overstated, as many women with early-stage cervical cancer may not experience any symptoms. Pap smears and HPV testing are critical tools in detecting cervical cancer early before it has a chance to spread. If abnormalities are found during these screenings, further tests like a colposcopy, which is a detailed examination of the cervix, or a biopsy, which involves removing a small sample of tissue for examination, may be recommended. Treatment options for cervical cancer depend on the stage of the disease and may include surgery, radiation therapy, chemotherapy, or a combination of these. The goal of treatment is to remove or destroy the cancer cells and prevent the cancer from spreading further. It's essential for women to be aware of the symptoms of cervical cancer and to seek medical attention if they experience any unusual signs, such as abnormal vaginal bleeding, or discharge pelvic pain, or discomfort during sex. Early detection and treatment are key to improving outcomes and reducing the risk of serious complications. Regular checkups, including pap smears and HPV testing, are vital steps in protecting your health and catching cervical cancer early when it is most treatable.